Good morning. Today is Friday, and it's October 16th, 2020. And today is a beautiful day. Any day that you can wake up and pinch yourself that you're alive, that's a good day. So at I'm here in California, and I'm talking to Jen Kimberly, and we're recording this for for educational benefits only. And this is for her private use. Jen, I'll be sending you a copy of this so you can review it. Also, if you have any questions about any aspect of what we're going to be talking about today, then that's great. If you have a health question, that's fine too, because I have a few minutes that we can do that. Behind me is a picture of the Rancho del Sol. Rancho del Sol is Jen, is a 40-acre estate where, as a young man, I had a dream to become a farmer. So, I raise avocados and grapefruits and other types of fruits and vegetables there. And it's closed at this time. We used to have clients come there to learn more about the PH Miracle lifestyle and how to implement that. So we had food demonstrations and lessons on how to prepare alkaline foods to various therapeutics such as lymphatic massage, colon hydrotherapy, infusions, infrared sauna, exercise, because we have beautiful mountains here that we can hike and climb around, over 3 miles of mountains. In fact, just an interesting point, you probably are familiar with the name Steve Jobs, who was the founder of Apple. Yeah, he's my next door neighbor. So before he passed on from his health challenges. But he lived longer than he was supposed to. So that was, a result of trying to apply principles that would increase the quality and quantity of his life. So each of us have a responsibility to ourselves. I believe that we need to love ourselves, and we need to love God, and we need to love our neighbor like ourselves. And as we do that, we take care of ourselves first, and that's what Jen is doing. And so over the last 40 years, I've been not only researching, but also teaching people how to take care of themselves by looking at drops of blood. And those drops of blood I call blood prints, and they're pressed upon a glass slide and then allowed to coagulate. One of my doctorates was in dissertations for one of my doctorates was called pathological blood coagulation. And you can find that article, Jen, at drrobertyoung.com. Just go to peer-reviewed articles. But if you go to Google and put in pathological blood coagulation, and I'll just, we have a chat section here, so I'm going to write that out. Pathological blood coagulation. And then it also discusses the live and dried blood from a scientific standpoint. And you can find that at drrobertyoung.com, or you can Google and find it under the heading of the title under the title. Google the title of the article and put in after it the publisher, who is Medcrave. Medcrave is the publishing company. And you'll find this article online for free. They sell it too. So if I click that, you can see that I've written you a note. Can you see that? Off to the right. You have to hit chat. There's a little square at the bottom. There's an icon called chat. You just click on that and you'll be able to see this. So I said, good morning, Jen, and pathological blood coagulation. And we're going to be talking about live and dried blood. Okay. In fact, I can actually bring you up a picture. Maybe I can find this picture here very quickly, just to show you. Let's see if I can find one. Well, I can show you this one. This one, so you can see that I sent you a little file here where you can actually see the different tests that we do. But that's just for your information. Let me see if I can find a couple of other things here for you, just to give you an example of what we're going to be looking at. Dry blood is quite popular right now because it's a way to not only, as we look at the patterns, it's a way to identify certain health challenges. You can identify in a dried blood drop, you can identify inflammation, you can identify proteins that are associated with that inflammation, as well as degeneration of any specific organ or gland. So it's quite informative that you can look at one drop of blood, and that drop of blood, oh, I know what I'm going to do, is I'm going to share the contents of this. Let me go to share so you can actually see what's going on. One second here. Okay, so I'm going to share my screen with you, okay? So you'll actually see my screen on your screen. So I'm going to hit share. One second. Okay, desktop. Now what I'll do, my picture of me will actually go up in the corner. You should be able to whoops. Oh, can you see the screen?
Yes, I see contents on the left.
Okay, so content. So if I go down, this is the report that I'm going to be preparing for you. And in this report, there's an introduction on live and dry blood. What is live and dry blood? The history of it, who I studied with, you know, who inspired me, the process that I've developed over the last 4 decades. And this is live blood. This is what live blood should look like.
Yes, I know.
Yeah, so you probably know this. This is what unhealthy blood looks like. And then this is what live dry blood looks like. Now, what we're going to do is we're going to press onto the slide, and we'll get into that in a minute. We're going to press blood on the slide, and I'll show you how to do that. And I want you to know that each drop of blood is a hologram of your entire body. So each one of those drops of blood represent you and your entire life at conception. And then on this, if this was like a record, if I put it on a record player, I could actually play your whole life for you. I could put that drop of blood on a player take the needle and spin it, and I can play your whole life. Every word, every thought, every deed is encrypted on that one drop of blood. Can you believe that?
Well, that's hard to believe, but okay.
Okay. Well, is it hard to believe that you have a recording on a disc, or a recording on a tape, or a recording on a DVD, or even now in the the ether, it's all around us, that there's information there that we can access. So that information about your life is encrypted on every one of these drops of blood, going all the way back to your birth, which is the smallest one. So each drop of blood measures a period of your life. So let's say you're 60 years, let's say we've got how many drops here? 1, 2, 3, 4, 5, 6, 7. 7 drops. This first drop represents the last 3 to 6 months of your life. So we take 6 drops, divide it into 60 years old, if you're 60 years old, and that each drop represents 10 years of your life. Now, another way to understand this is if you look at a tree, and if you cut the tree, you can actually see for each year that tree's been alive, you see a ring. So each drop of blood, just like a tree, has rings. So what I do is in my mind, I superimpose you on this drop of blood, and each ring represents a place within your body that allows me to evaluate, you know? So when we're looking at a drop of blood like this right here, and I see that it's not clear like this, there's an imperfection in the drop. Can you see those white dots?
Yes.
Can you understand that that is an inflammatory condition of the pelvic area? It's in the center, and this is one of the smaller drops, so it started very early in life. So that tells me that this patient has had an inflammatory condition for a very long time. They've had troubles with their stomach, with their small and large intestine for years. Where you see these black lines are proteins that when you cut yourself, they form a clot so you don't bleed internally. When you're missing those clotting proteins, then the neurological system is not functioning, the endocrine system's not functioning, and you're not producing fibrin monomers, and that indicates an imbalance. You know, the diet's too high in carbohydrates, too high in sugar. So with one drop of blood, you're sharing with me your entire life. Are you okay with that?
Yes, I'm rather astounded, but yes, okay.
Okay. So when I see this, I can look at it from a physical perspective. I can look at it from a feelings and belief or emotional or mental perspective, or I can look at it from a spiritual perspective. Because all things are manifested in these little simple. So your blood is your life. And I wasn't the first one to say that. An ancient prophet by the name of Moses said, for the life of the body is the blood. And Muhammad said, don't you understand? He put it in a question. Don't you understand that you were created out of one drop of blood? Very few people on the planet understand that the blood is the stem cell. It's what all body cells are created from. So I'm going to look at the blood. And in this case, when we're looking at dry blood, you'll see a report like this. And in the report, I'll also provide a protocol and suggestions and in this case, this is not normal. See all these white areas of missing protein? This is what they look like magnified. The body should not have free protein in it. That's an indication of cellular breakdown in specific areas of the body. In this case, it's the lung. So I'm able to look at the drop, look at the imperfections, and in that see patterns that relate specifically to specific areas of the body, specific organs, specific glands, and specific condition of each and every tissue, organ, gland of your body in one drop of blood. I can tell, whether you're healthy or you're not healthy. And then I'll, of course, summarize that. And that report's about 30 pages long. So this is kind of a process. It's not like going to the doctor, and taking some blood and then sending that off to the lab and you get the results back. There's more of a process here that requires, placing the blood onto the slide properly, evaluating that blood, qualitatively and quantitatively, and then taking pictures and then taking micrographs. These are micrograph pictures, and then putting those into the report, and then, of course, sending that to you. So does that help you a little bit understand what we're,
Yes.
lot more than probably you understood before, right?
Oh, absolutely, yes.
Yeah. So I'm going to go back now to, by the way, probably the book that speaks about this, where you have kind of everything in one book, is called Sick and Tired, Reclaim Your Inner Terrain.
I have that book. It's right here under my.
Yeah, so I have pictures of blood in there, and I have and oh, by the way, that article that I spoke about, pathological blood coagulation, it's in the back of the book.
Okay.
If you go to MedCrave, I've just updated it, and you might find it more accurate if you go that direction. So I'm going to stop the share now and come back here. And then I'm going to take off the screen setting. Let's see. I just want to go to none. Okay. So now you can see me without all that in the background. All right. So I'm gonna push this back just a little bit, and from there, I'm going to show you these tissues. You see these tissues? They're called Kim wipes. You see?
Yeah.
This is not Kleenex. This is a special paper. Kleenex is made with a fiber that if you push it, if you go like this to your finger, you're going to leave fragments.
Yes.
From the tissue. This doesn't do that. Okay, so it's very important to understand that when you're cleaning your finger off, you don't want to use alcohol. You just kind of clean it off like this. You just kind of take one of these and clean it off. So I put several of these in there for you. Just want to take off any excess oil, and for women, any lotions or potions should not be on your hands.
Are you saying do that now?
Well, we'll get to that. I'm just identifying what you should have in your little kit.
Okay.
Okay. Also in your kit, you should have one of these.
Mm-hmm. Yes.
Okay. Have you ever used one of these before?
No.
Okay. Do you see this little gray part here?
Yes.
Okay. This little gray part, you just kind of twist. Don't put your finger on this little trigger. That's the trigger of it's spring loaded. So if you hit that, the needle comes out. This protects the needles. So these are one-time use lancets. that are 100% sterile. So what you do is you take this here at this particular point, right? Let's see. You take this at this particular point and you twist it like this, and then you just pull it out. Okay, now this is ready. Okay, so you make the peace sign, you flip it over like this, you take this and push it into the pad of the finger while your finger's on the trigger. Okay, so can you see? I'm setting it not down here, not off to the side.
Right.
See, I'm sitting it right on top of the pad, the level part. I'm pushing down, and then I'm going to pop the trigger. Pop. I'm a baby when it comes to taking my own blood. So now I just got through taking that. If you'll notice, what's happening is a little drop of blood has appeared. I then take my Kim wipe and I take that off because that first drop of blood contains, damaged cells. And then what I do is I take my thumb and my finger like this, and I put it to the side of the finger, and then I kind of pull it apart like this to express the blood.
I can't see your finger.
See, so I then, I take these fingers and I pull the skin apart like this.
Right.
And I express the blood. Okay, it's okay to let that sit there. It's okay to let that sit there for about a minute. What you're doing is allowing gravity and the rotation of the earth to create a natural centrifugal force to allow any particulates in the blood, okay, to spin down and settle. And if their particulates are heavy proteins, they'll spin out a little further and further. So, when you flush your toilet, it goes like this, down. Right. So when you have a drop of blood, like this, and I can express it again, when I let it sit there, I'm allowing the blood to naturally spin. And as it's spinning, it's kind of like panning gold. Any particulates in the blood will fall to the bottom, and the heavier pieces will fall to the outside. So proteins from skin, if you have skin problems, will spin out to the outside. Where problems with the pelvic organs and glands will settle to the center. So if there's an inflammatory or degenerative condition of the female reproductive organs, those proteins will fall to the bottom and stay there. If it's inflammatory, it'll be circular if it's irregularly shaped. So that's what I'm doing, is I'm doing this. Then, what I've done, and we'll prepare these slides before. I don't know if you have an indelible marker or not, but if you notice this slide, it has a cover slip, okay? It has a frosted end.
Yes.
See the frosted end?
I see that, yes.
Okay, so when I handle the slide, I never touch the surface of the slide. I handle it from the side.
Right, okay.
Or on this portion. And I always keep my slide level. So when I have my finger here, for demonstration purposes, what I do is I keep my slide level and I come down and lightly touch the finger and come up. And then come over, go down and up, just like this, until I've picked up all the blood. And I've now prepared my slide, you see?
Right, yeah.
You see that?
So that's why the drops get smaller.
They get smaller because you're slicing the blood off.
Right.
Okay? And each drop of blood is important because each drop of blood represents, a time in your life, but it also represents, this blood also represents the health from a point of if it's just a temporary problem or if it's an acute or chronic problem. Okay. So it's a wonderful screening test because I can see years in advance of a pattern that's expressing itself that can be reversed prior to any symptomologies. So if someone has a precancerous condition, I can see that before it shows up as a degenerative condition of the tissue. Isn't that cool?
Very cool. Why don't the cancer doctors do this?
Why? Because they're not educated in it.
Okay.
They know what they know. They don't know what they don't know. Okay. So I've published on this, and I've educated on this at different levels of academia, and it's, I've taught people all over the world this technique. Okay. But it's a very quick way to determine what's going on inside your body without having to run to the hospital.
That's a great blessing.
Yeah. So, I'm happy to share it with you because it's been my passion and love for over four decades. So let's get back to this. So that's how you prepare a slide. So the first thing you do is you take one of your Kim wipes and you set it down on the table here. Then you take your slides out of your little carrying case, and you set those slides on the tissue, okay? Like that. Can you see that?
Yes.
Okay, then once you're ready, you take out your lancet. Okay, you take your lancet, so it's ready, and go ahead and unscrew the top of it. Just twist it and then pull it out. Don't push the trigger yet.
No.
And then you can set that right there too. Do you have any of these cover slips? Did I send you any of these?
Yes.
These are these little pieces of glass, little thin pieces of glass.
Yes. I have
Did I send you these?
Yes.
Because when you're doing this one, I'll show you. First off, you express the blood. Let's see if I can do that again. Okay, you express the blood. Once the blood is expressed, you then take your cover slip by the edges, come close to the blood, and allow the blood to jump onto the slide like that. You then take it and set it down on, and it creates as you can see, it creates a little blood drop. See, I don't touch the blood. The blood, through electromagnetic attraction, jumps onto the slide. So one of your slides you're going to do like this with the cover slip, and then the rest of them you're going to press like before. So, and you remember you use I call it the triangle approach, where you take your thumb, and on your opposite hand, the thumb and the index finger, and you don't squeeze, but you pull apart to allow the expression of the blood. And then very simply again, you then, if this is a helicopter, on a level plane, you keep it level and you go down on the blood and up. And you do touch your finger lightly. Just like that. And then you flip it over. Remember to flip it over because if you don't, you'll put it down on the tissue and you'll ruin the sample. So that is what you do. Those are the two slides. I'd like you to make two of those types of slides and then two of these. Now, when you're finished with this one, you then take some crazy glue and you seal it on the edges with crazy glue. Now, the reason why you put crazy glue or some sort of a clear plastic glue is you don't want air seeping underneath that and destroying the sample. So you seal it so I can view it.
I don't have any crazy glue. I didn't know I would need that.
Yeah, I understand. Usually we have, but you can do that test later if you want. I'll send you this to do it, but you just want to seal that. If you want to do that later, you can. In fact, you can do all of this later, for that matter. You can think about it, but that's how you take the blood. Yeah, just like that. And how many slides do you have?
6.
Okay, so let's practice with one of your slides.
Yeah.
And see how you do. Okay, so two of those slides, at least one of them, is for practice. But this is what the slide should look like when you finish. You see,
yeah,
you should have about 7, 8, or 9 drops on that slide, going from large to small.
Right.
Okay, I know you can do this. And I know this is the first time that you've ever done this.
Yes.
But there's always a time for firsts. And if I can do it, you can do it. Okay?
Okay. I'll have to wipe the slide first. Is that right?
With the slides are sterile. If you want, you can take your Kim wipe and just dust it off, but you don't have to do that. They are sterile slides, but you can just kind of clean it up, but don't touch it with your hands. Always handle the slides on the edges.
Yeah.
Never touch the surface. The only part of the slide you can touch the surface of is the frosted side. That's it. I mean, if you feel more comfortable holding it like this and doing the process this way, I have more control personally by holding it like this. And then I can touch down.
Yes.
That's just, it's a matter of preference. Either way, there isn't one or the other way which is better. It's what you feel more comfortable with.
Now, I think your directions say that I should prick a finger on my weak side or left side.
Yeah, generally you ask yourself this question: what side do I have more health challenges? Or, excuse me, what side is the weaker side?
Yes.
And so, but in this case, if you're right-handed and have better control, let's say your right side, but generally, if you're right-handed, the left side is the weaker side.
Well, here's my situation, Dr. Young. I have some remaining arthritis, and in the right thumb, it makes the thumb unreliable, so sometimes it will jerk and drop whatever it's holding. And I have a more reliable control in the left thumb, but the left side of the body is the one that the stroke damaged, and it's weaker.
Okay, well, we won't worry about left or right then. It's okay. Let's use the hand that's more stable to take the blood.
Okay.
From the right side. I understand. I mean, blood flows through your entire circulatory system. One blood cell will make a round through entire blood within 60 seconds.
So quickly?
Yeah, so quickly. So blood is a living, intelligent being. And so it knows your nose, your eyes, your brain, your heart. It knows all of this.
Yes.
So it has information about your entire body. So I can look at one cell or I can look at a grouping of cells. In this case, we're looking at a grouping of cells.
Yeah.
Okay, and how they coagulate. So pathological blood is the pathology of the blood. It's the path. Okay, so we're going to go down the path, and the blood is going to teach us. But now I need you to put the blood on the slide, and then once you put it in on the slide, you allow it to dry. Once it's completely dry, you then set that back in to the carrying case, those little cardboard cases.
Yeah.
You put your name at on the case, you put the date, you tape it, so it's secure on all sides. Okay? And then you put it in a bubble wrap container and you send it back to me. Now, I'm going to write down the address here that you need to send it to me, okay?
Okay.
15120 Hesby Street. And that's in Sherman Oaks, California. Okay. What is the zip code? I'll have to look that up. Anyway, that's 91.
Mail me that address or what?
Yeah, I just sent it to you on chat.
Oh, on chat. Oh, yeah. Okay.
Yeah. Any questions so far? Are you ready to go ahead with your first trial of pricking your finger and allowing it to beating it up and letting it sit for 30 seconds or so, and then picking it up from the finger and placing it onto the slide? Now, just remember, I'm going to say this one more time. Keep your slide level. Keep your slide level. Okay, so keep the slide level. And when you're picking up the blood, make sure you lightly tap. Don't slam it down, but lightly tap the slide and pick it up just like this.
Yeah.
Okay, once you're finished, you just flip it over. Once again, all you do is once the blood is expressed, you just lightly tap, okay, placing, and then flip it over. Set it down, let it dry. Once it's dried, put it into the cardboard container, put your name on it, put the date, seal it, and send it back to me. Once I receive it, I will put it under my compound light microscope, look at it under phase contrast and bright field, and prepare a report. The other one, if you have the cover slips, is using that very delicate, you see that very delicate cover slip here. And here, all you do is just allow the blood to jump up to the cover slip, and then you put it down onto the slide. And once it's on the slide, like this, once it's on the slide here, you seal the edges around it with crazy glue. That's it.
So I'll have to, this is a rehearsal right now, but for the real thing, I'll have to go and buy some crazy glue first, right?
Yeah, you can. Yeah, I don't need to watch you do it. I mean, I'm going to send you this video and you can listen to it again, so you don't have to remember everything I said. Okay. You can watch it over and over again, and then when you're ready, I mean, if you want to try a test run on the dry blood, that's the most important to me. We can try that and see how you do. I can watch you do it and make some critiques, or you can do it on your own, whatever you feel comfortable with.
So are we about to end this call then?
Yes. Yeah, that's all you need to know, unless you have a question.
Um, no, I think I think I understand,
Okay.
and I will watch the video again just to make sure.
Yeah, if you're uncertain, we can have another conversation if you'd like, and pick it up from there. But what I'll do is I'll download this, download it to YouTube, put it on private for only our viewing, okay? So it's totally confidential.
Oh, how do I get to it?
I'll give you the link. You just
Oh,
click on the link and watch it.
okay.
So tell me what you would like to do. Do you want to give it a go, try one, see how you do?
Yes.
Or do you want to wait till later?
I think I want to wait.
Okay. You can have, I don't know if you have a friend or something, the friend can take the blood too. They can watch this and you can have some assistance, have someone come and help you with it if you'd like. Or you can do it yourself, just like I showed you, okay? But you can watch that over and over again and then give it a go. Whatever blood that you end up pressing onto the slide, whatever blood you press, send it to me because I can use it. Okay.
All right, even if I did it wrongly.
If it's on the slide and it dries, I can use it. I mean, so, I mean, yeah, okay. I've been doing this for quite a long time, so it's very natural for me to show you this. But
Yes.
here again, whatever you press onto this slide, once it's dried, you can send it to me. Okay.
Okay.
I'll look at all your samples. Any other questions?
No, but usually I'll think of questions a little later. So can I email you, or what's the best way to get in touch with you?
Watch the video, and
Mhm.
then I'm going to give you my cell phone number. And also my email. However you feel comfortable. How's that for you? Isn't that cool, technology? So we
Mhm.
can have this conversation face to face, and I can help you.
Yes. Yes, I have that phone number. I have 3 phone numbers for you, but never knew which one I should use.
I just gave you that.
Yes.
So I look forward to seeing your blood soon. And as soon as I get it, I will evaluate it, put it on, take pictures, take micrographs, and then set that into a report and send it back to you.
Great. Okay.
And then once you've done this once, we can always follow it up later for follow-ups. That's fine because if you're having a health challenge, all you have to do is press the blood onto the slide, send it to me, and I can look at it and tell you what's going on.
Well, I saw that on the health history form. There were all those columns.
Yeah.
So in other words, there's follow-up in that respect too. I can see
Yeah,
improvement,
those are
health
just,
improvement.
yeah, because that's from your perspective. I'm interested in knowing what you're feeling, what you're thinking, and what is your health history. And with that, it also will coordinate perfectly with the blood. So what I see in the survey that you take, there's no mystery of it. I can look at the blood and then look at the health survey and and see that it'll match up to what you're feeling, what you're experiencing.
Right.
Okay, there may be some things that we see that you don't know.
So now if I think of a question, say tomorrow, and I've got crazy glue and ready to go, and I have a question, should I call you on that number then?
Yeah, just give me a call.
Okay. Oh, thank you. Thank you, Dr. Young. This is quite a this is a big turning point in my life, I think.
Absolutely. I mean, this should be available to everyone on the planet, but taking personal responsibility for your health, it should be priority number one, rather than putting it in the hands of other people. That creates a lot of anxiety. It creates a lot of uncertainty in people. But
Yeah.
once they understand how and have the knowledge to take care of themselves and monitor their health by testing the urine and also testing the blood, this is a very simple way to stay on top of your physicality, and keep yourself healthy and ward off anything, because it's a lot easier to prevent something than it is to treat something.
Yes, sure, right.
Okay, well, if that's all, I'll go ahead and end the recording. Just mention again that this is a private educational presentation for the benefit of Kimberly, and for her private use, and not for using it for not to use it for any commercial means for promulgating business or anything like that. It's just, this is your health, this is your life, and it's about you. And so it's for educational purposes only. Okay?
Yes.
So with that, I will end the recording and say thank you for the opportunity to assist you on your personal journey that will lead you back to the house of health. This is Dr. Robert Young saying good morning, good afternoon, and good night.